Hello, everyone. I am Dr. Chris, a consultant family physician and a lifestyle medicine expert. Today, I will be discussing how to reverse erectile dysfunction and low fertility in men. What is erectile dysfunction? Erectile dysfunction is the inability to achieve and maintain an erection firm enough for normal sexual intercourse. Obesity causes erectile dysfunction in men as well as causes low sperm count, which leads to low fertility in men. I shall discuss more on the pathway or on how obesity causes this in the course of this discussion. Now, what is obesity? Obesity is a condition where there is excess accumulation of body fat in an individual. How do we diagnose obesity? We can diagnose obesity by measuring certain anthropometric measurements such as weight, height, and waist circumference. Now, when we measure the weight in kilogram as well as the height in meters, we can calculate what we call the body mass index BMI. The body mass index is calculated using the formula weight in kg divided by the height in meters squared. When you do this, if the answer you get is more than 30 kilogram per meter squared, this is defined as obesity. Then the waist circumference is usually measured using a measuring tape and measured roughly around the umbilicus or belly button. And if the value is more than 102 centimeters, this also qualifies for abdominal obesity. The waist circumference is actually more sensitive in diagnosing obesity because the BMI has some limitations. For instance, the BMI may wrongly classify individuals who are very muscular and athletic. It may classify them wrongly as being obese, whereas they are of normal BMI. This is because the body mass index does not take into account the muscle mass of the individual. Also, the BMI also has other limitations in that it does not tell us the distribution of the body fats. And the body fat, which is of more important medically, is the fat that is accumulated around the trunk, around the belly area. That's the fat that is of more medical importance. And the waist circumference measures just that. So the waist circumference is more sensitive. So you may want to combine the waist circumference as well as the BMI when trying to assess whether you are obese or not. Now, I'll move on to the next outline, which is the prevalence. The prevalence of obesity worldwide is about 14%. This means that 14 out of every 100 men are obese. And as the prevalence of obesity is increasing, so is the prevalence of erectile dysfunction in men increasing. Like I've already said at the beginning, that obesity leads to erectile dysfunction. Now, let us move to the next thing on the outline, which is how do obesity cause erectile dysfunction and low fertility in men. This can occur through three main pathways. One, it can occur through the cardiovascular pathway. Second pathway is through the neuronal pathway, and the last pathway is through the hormonal pathway. One, through the cardiovascular pathway, obesity leads to poor cardiovascular health, leading to poor blood supplies to the male genital, leading to erectile dysfunction. Two, the second pathway is through the neuronal pathway. Obesity leads to metabolic disease and disruption of metabolism, which eventually leads to damage to nerve that supply the genitals. So this leads to erectile dysfunction because the nerves that supply the genital organs have been damaged due to obesity. Then the third pathway is through the hormonal pathway. The more an individual has belly fat, that's a truncal obesity, the more the enzyme aromatase is produced. This enzyme aromatase is the enzyme that converts the male sex hormone known as testosterone. It converts it to estrogen, which is the female sex hormone. So the more an individual has body fat around the trunk, the more the production of the female sex hormone instead of the male sex hormone, leading to low libido, erectile dysfunction, and low sperm count because testosterone is necessary for spermatogenesis, which means sperm production. So with obesity leading to decrease in the level of testosterone, this eventually leads to decreased sperm production, leading to low sperm count. Now, how do you treat erectile dysfunction due to obesity? Avoid quick fix. A lot of people go for a quick fix by taking the drug we call the phosphodiesterase inhibitors. This drug offer only a temporal relief by improving the blood flow to the genitals and is usually taken about 1 hour before sexual intercourse. But it does not address the root cause of the problem and it may also have dangerous side effects ranging from headache to hypertension and even cardiac arrest. The best way to treat erectile dysfunction due to obesity is to address the root cause, which is obesity, and reverse it. Once the root cause is reversed, the erectile dysfunction reverses. I'm going to highlight 3 ways in which you can use to reverse erectile dysfunction and low fertility in men using lifestyle medicine approach. One, you need to fix your diet. Focus on eating balanced diet that contains single ingredient whole food. Avoid junk food, especially those made from flour like cake, donuts, and many others. Avoid high carbohydrate diets like pasta and other very high carb diets. Avoid taking soda, alcohol, and cigarettes. Then the next step is for you to practice intermittent fasting. This will also help to reverse the root cause, which is the obesity. And the third lifestyle measure you should take is to exercise. You should do a combination of both cardio, and resistance training, as well as Kegel exercise. If you adopt the above three measures I've mentioned, which is fixing your diet, practicing intermittent fasting, as well as exercise, you would lose body fat and eventually reverse your erectile dysfunction and low sperm count naturally without needing any medication, and the result you obtain or you get is more sustainable. Thank you very much for watching. Please do not forget to like, share, and subscribe for more healthy lifestyle tips like this. Thank you.